Hello, everybody. Welcome to the wonderful NERI Press webinar on putting prevention in the hands of youth-serving organizations with Keith Kaufman. It's always really wonderful to see how much interest people have in these webinars. And for those of you who don't know NERI Press, our mission is to share the cutting-edge research and the best practices that are emerging in our field. This certainly counts for one, in my opinion. For those who don't know, Steve Benjes and I, who are working here at NERI Press, for many years we sold only books, but in the last 5 years we've begun to offer online courses and newsletters that take one research article each month and puts it into an easy-to-read newsletter. And now most recently we're offering these free webinars by some of our internationally recognized authors. We hope that you'll be consider becoming a sponsor of this series for next year, or maybe buying one of our books, because it's actually this kind of support that allows us to run these free resources for you. I also want to just take a moment to give a shout out to the NERI School. If you've never looked at the NERI School, which actually helps to support the NERI Press, please take a moment to look at the website and offer your support to the school as well. Before we get started, I'd like to just take a moment to offer a quick poll, and that the poll, just to give a sense of whether or not you've ever attended a NERI Press webinar before. It gives us a sense of who you are as well. So if you could just answer the poll, take a quick moment, and we can then post those results. Looks like it's about, that we're talking about, let's see, about 2/3 of us have attended one before, and about 1/3 have not. So that's really wonderful. Thank you. It's helpful just to be able to see that. Then I want to also just take a moment to do a little bit of housekeeping. And just like any other webinar or any other workshop you might take, we have learning objectives. So the 3 learning objectives we have is to better understand the need for additional prevention strategies to enhance the safety of everyone within youth-serving organizations. Second, to describe the situational prevention approach and its role in enhancing safety. And third, to provide preliminary evidence for the effectiveness of the situational prevention approach. Second, I just want to say that the PowerPoint is posted on the NERI Press website, and that also we'll be posting a recording of this webinar next week. So at about a week from now, we will be sending you out an email which gives you a link to the recording and also a link to the certificate of completion if that's important to you. Third, when the workshop is over, please be sure to close out your account. We'll be sending you automatically an evaluation, and we really would love your feedback, because that's really what helps us keep these so current and helpful. Last, for those who are interested, we now offer continuing education credits as well. So to do that, all you have to do is sign up through the Orlando Behavioral Health, and that's also on our website in case you forget that link. But through that, you can take the test. It's $5, and you can get continuing education credits. So last and most importantly, I want to take a moment to introduce Keith Kaufman today, and I'm really thrilled to do so because I've had the pleasure to work with Keith and learn from Keith for many, many years at this point. So Dr. Keith Kaufman, for those who don't know, is a licensed clinical psychologist and also a professor of psychology at Portland State University in Portland, Oregon. Dr. Kaufman has provided program consultation in the areas of organizational safety, prevention, juvenile offender assessment and treatment, and program evaluation and research. Dr. Kaufman has recently been featured as a speaker in a whole variety of events, including the U.S. Olympic Committee's first Safe Sports Summit, the Penn State University Child Sexual Abuse Prevention Conference, the Boy Scouts Youth Protection Symposium, and the National Center for Missing and Exploited Children's Safe to Compete Youth Sports Summit. So he's clearly in high demand. Dr. Kaufman has also authored a number of books, a variety of book chapters, and numerous research articles addressing sexual violence prevention. And his most recent book, which we are thrilled to have published here at NERI Press, is Preventing Sexual Violence, a Practitioner Source Book, which is a comprehensive sexual violence prevention volume. And I think the other thing I want to do a shout out for Keith is that he co-authored the first prevention chapter to be included in Interpol's member manual. So without further ado, I'm going to turn this over to you, Keith, and I'm looking forward to hearing your presentation. Great. Are you there, Keith?
I am.
Okay, great. So we're switching over to Keith's slides. And
Joan, thank you.
Yeah.
I appreciate that nice introduction. I'm very excited to be here. NERI has been a wonderful partner for a long time, And it's a real treat to have an opportunity to talk a little bit about prevention, especially prevention focused on youth serving organizations. I wanted to start by sharing one of my favorite, if I can get this to switch. Sorry, I'm locked up. One of my favorite quotes from Albert Einstein. Albert Einstein said that intellectuals solve problems and geniuses prevent them. And I have to say that it's that kind of inspiration led to this book with Neary Press. As far as we know, it's the only comprehensive volume that's dedicated to the prevention of sexual violence, and moreover, one that's focused at the level of how-to oriented and very practically oriented. We've had more than 60 nationally known experts as contributors as part of the book. And really it is focused for practitioners, for folks who work for organizations, victim advocates, prevention specialists, treatment providers, and other professionals in the field. One of the things about the book that made us very excited was the breadth of content. The intent was to try to cover as much of the field as possible, to really have a one-volume type of source book. It includes chapters that span the range from internet safety to how to arrange and set up bystander intervention programs, national policies on prevention, how we might think about preventing sexual violence in sports. And then there's a number of chapters that I authored or co-authored, and they include some of my research, my past research on using offenders' modus operandi to create more effective prevention programs. And then, of course, there's a chapter in there that is the focus of today's presentation, creating safer youth-serving organizations using the situational prevention approach. And one of the things that Neary was really kind about was arranging for a week-long discount to kind of celebrate the book and to encourage folks who participate in the webinar to take advantage of that. So if you're interested in the book, please give Neary a call and just let them know you were part of the webinar, or use my last name as a code. So as I mentioned, the focus of today's webinar is work that I've been doing for the last 8 or 10 years. And the goals of this webinar are to identify the scope of safety concerns in youth-serving organizations, describe the situational prevention approach, and to briefly talk about some very promising findings from a 3-year prevention trial that we're finishing up with Boys and Girls Clubs of America, that was very generously funded by the Pennsylvania Coalition Against Rape. So let me begin by just briefly talking about the scope of safety concerns. Usually when we think about youth-serving organizations, we start by thinking about more leisure-oriented organizations, such things as Boys and Girls Clubs, sports teams, and such. But I'd encourage us to think more broadly about youth-serving organizations as any organization in which a child is involved or a child has contact. And really our long-term goals ought to be to make sure that all of these settings and systems are safe for our children. If we take a look at participation in youth-serving organizations, there's a huge number of children and teens who participate every day. Estimates suggest that more than 50 million children and teens attend school each day, and more than 30 million children each year are involved in either inpatient or outpatient hospital services. There's more than 44 million children and teens who participate in youth sports every day. And then, of course, there's tens of millions of children who are involved in other types of youth-serving organizations, everything from summer camps to specific organizations like the Y, Boys and Girls Clubs, Boy Scouts, Big Brothers and Big Sisters. Now, I don't want you to get the wrong idea about youth-serving organizations. As we all know, they provide some really wonderful benefits. They focus and help support healthy and productive lifestyles. For many youth, especially youth in impoverished areas or dangerous areas, they actually provide a safe haven or a supportive environment, someplace the children can go and know that they're going to be safe. They offer educational and practical life skills, and they offer very positive models for supportive adult relationships as well as supportive and positive peer relationships. So what are some of the reasons why we really need to be concerned about youth serving organizations, or YSOs? Well, we know from interacting with offenders and from the literature that any place that there are large groups of children and teens are places that attract offenders. We also know that many of these organizations have very large staffs and to a great extent utilize volunteers, and sometimes these volunteers in particular are less carefully screened. And as a parent, I can tell you that I always thought when I dropped my children off at an activity or an educational type of event or any type of organization, I always thought that they were safe. So I think parents come to this with the idea that they don't have to use their supervision or their eyes to make sure, because these are places where they can drop their kids off and they'll be safe for whatever time they're there. At the same time, we know that abuse continues to occur. Despite general declines over the last 10 years, there are still more than 63,000 reports of child sexual abuse, and we know that child sexual abuse is grossly underreported, so we believe that there's many more cases that are out there. Sadly, there's no national tracking of child sexual abuse in youth-serving organizations, and yet when we look at the media, we know that child sexual abuse, as well as other types of inappropriate sexual behaviors, continue to occur in youth-serving organizations. In fact, if we look over time, few, if any, youth-serving organizations have been spared from having very public cases of child sexual abuse in the media. So when we think about concerns with regard to youth-serving organizations and child sexual abuse in particular, we usually focus on pedophiles. But I think it's really important to think more broadly. We need to be in the business of also making sure that kids are safe in their families. We need to think more broadly about opportunistic types of situations, either from adults or teens or other peers. We need to think about status offenses that occur with perhaps an older teen and a young adult. And we also need to be thoughtful about not just child sexual abuse or sexually related behaviors, but also other types of general criminal behaviors that our children are vulnerable to when they're at a youth-serving organization. And with that in mind, usually we think about child sexual abuse because that's really what's prominent in the media. But we need to be concerned and make sure that we prevent inappropriate peer-to-peer sexual behavior, accidents. Actually, in many youth-serving organizations, accidents are really the most prominent way in which a child is injured. We need to worry about physical safety threats that might include bullying or peer-to-peer aggression. And of course, health concerns. And the health concern could be anything from improperly prepared food to a swimming pool that's not quite right. So again, I don't want to give the impression that there's some reason to believe that youth-serving organizations have just rolled over and aren't doing their due diligence. We've actually seen some huge increases in attention and focus on prevention and efforts to make youth-serving organizations safe. It's become a standard to do background checks, and I think that youth-serving organizations are always looking for new and cutting-edge ways to make their environments even safer for the youth that they serve. I think it's worth taking a minute and thinking about what we're looking for when we talk about prevention. What's an ideal prevention approach look like? As we just talked about, I think that it would be ideal if it was comprehensive in scope. So clearly it should address issues around inappropriate sexual behavior and child sexual abuse, but it should also deal with all other kinds of vulnerabilities that occur for our children and teens. It has to be sustainable, so it has to be low cost or no cost, and it has to be easy to complete in these environments. I'd also say what we need more process-oriented prevention approaches. And let me take a minute and talk about that. I would suggest that 95 to 98% or more of the prevention we do is what I would call content-based. It's checklists, it's sets of steps, it's a curriculum that's fixed and invariant. It's something that is an off-the-shelf type of approach that can be very effective, but it doesn't capture all the issues that are going on at a moment in time. In contrast, a process-oriented approach, and the situational prevention approach I'm going to tell you about is process-oriented, is more adaptable to different organizational goals. It's also easily tailored to local sites' needs, and it offers broad-based grassroots involvement. And by that I mean it takes advantage of your experienced staff and your experienced knowledge in both identifying concerns and also responding to them. Process-focused also means that it's dynamic and it addresses the changes in organizations over time. And finally, I think most importantly, process-focused means that it focuses on identifying local germane risks and offering effective practical solutions to those risks. Now, the approach that I said we would talk about today is called the situational prevention approach, and I think that it's very promising in the data that we've been collecting, and I'll tell you more about that in a minute. I would say that it meets all of the ideal prevention goals we just talked about. It's rooted in research and theory. In fact, it's rooted in strategies and ideas that have been used for more than 50 years to create safer housing around the world. And more than 20 years, it's been used as a foundation for crime prevention. What's new about it is it's really an approach that only in the last 6 to 8 years have we looked at applying it to youth-serving organizations, and especially to issues related to the prevention of sexual violence. Situational prevention approach is a 6-step process for identifying youth-serving organization risks and developing effective solutions. It focuses on 7 key areas, and I'll tell you about those in a minute, and it encourages the development of a very tailored prevention approach or the use of risk reduction strategies that are specific to a particular need in a particular organization at a given time. So let me give you a little bit more detail about the approach, and then I'll tell you about some of the findings of this prevention trial we've done with Boys and Girls Clubs of America. So the first step of 6 steps in this process is a brainstorming step. And the idea here is, or the goal is, to capture all of the risks that are identifiable in a particular club or organization or youth-serving organization at a particular site at a given time. And part of the way we do that is we convene multiple focus groups. So for example, with the Boys and Girls Clubs, we have a work group that represents staff and volunteers, some board members, and some administrative staff. We also have a parent group that comes in and shares their insights about risks that may exist. And then also with the Boys and Girls Club, we'll include a older youth participant group to give us that perspective as well. Now, part of the core of this approach are the 7 areas that we asked these 3 groups to brainstorm. And I'll draw your attention to the 2 rectangles. The black rectangle that's marked organization environment is really the areas that we brainstorm within that are areas that the organization has the most control over. The blue rectangle around that that's marked community environment are the ways in which that organization bumps into the community and the kinds of risks that come from that. Now, the organization may have some control over those risks, but it's not complete. So again, these are the 7 areas that we ask the groups to brainstorm as part of this first step. So the first area is characteristics of at-risk youth. And this would include both characteristics of the children themselves as well as their family or parents. So for example, a characteristic that may be significant is a child who's lonely or needy, or a child with a cognitive disability may put them at greater risk. On the parent side, we may be concerned about parents who provide poor supervision, or maybe even a parent or parents that have drug and alcohol problems that interferes with their supervision of their children. A second area that we ask these groups to brainstorm are high-risk locations in or around the organization. And here we're focusing on the structure or building, if the organization has a building, and the grounds that they control. Some examples might be a kitchen that's deserted after lunch, or isolated classrooms, maybe in the evening, side stairways, or bathrooms on the outside, might be a baseball dugout that's hard to supervise. And we also extend this to any of the types of sites that a organization may take youth to on a field trip, and also we think about risks related to transportation. The third area that we focus on is something called facilitators. Now, facilitators aren't necessarily risks in and of themselves, but they're a factor that may cause what we might consider a bloom of risks. So, for example, on a sunny June day, when two of your staff decide that instead of coming to work, they're going to go to the beach and call in sick, you may have a whole day of having a disproportionate number of children to staff. That may cause risks that may be related to kids who are engaged in high-risk behaviors during play. It may be easier for kids to sneak out, maybe get high behind the building. It may be that they may be more vulnerable to other people, adults or teens, walking up and starting to interact with them. So facilitators are something that we worry about. Facilitators might also be things that we don't commonly consider. So, for example, a trusted employee might be a good example of a facilitator, because it may be, we know that employees that are long-term employees aren't supervised in the same way, and they aren't held to the same standard. People will often say, well, Joe's been here for 12 years. If he does it, well, then it must be okay to do, and we don't need to worry. As part of the brainstorming within the organizational parameters, we also think about health concerns, accident prevention, and physical safety. And those would include things like worrying about illness from spoiled food or mold in the walls, worrying about accident-related, especially we live in Portland where it rains a lot of the year, so we worry about slips and falls as accidents, or accidents from poor sports equipment, for example. And then safety might have to do with gang activity that comes into your organization, or bullying. The final area that we focus on in terms of the brainstorm that's within this organizational box are organizational policies. And these usually focus on either policies that don't exist at all and need to be added, policies that need to be updated or modified, or wonderful policies that may exist, but if someone doesn't receive orientation, they may not know that those policies exist as a staff member or a volunteer. So let's move now to the areas that we brainstorm that are more community connected, that organizations bump into and are worth considering. So some of the community policies we worry about are things like hedges that may be too high in a park that your organization uses on a regular basis, either for the baseball diamonds or for outings, locker room or pool policies at a community pool that you use, or even unclear supervision at a game room in the local area. We also ask our focus groups to focus in on what we call lifestyle and routine activities, and we're interested in both the routine activities of staff and volunteers as well as families. So on the staff and volunteer side, we're concerned about such things as one-to-one activities like mentoring opportunities at times that may be done alone in a particular building, intimate care responsibilities like taking a child to the bathroom, or transportation, such as on field trips. On the parent side, we might have parents who work 2 jobs and aren't very available for supervision, or even a family that, or a parent that drops their child off an hour early before you open your doors because that's when they have to go to work and their children end up spending that hour by themselves. We may also be concerned about issues around children walking home alone at night, especially in the winter in the dark. The final area we ask folks to brainstorm for risks is what we consider the larger community environment. And that could be anything from concerns that have to do with gang activity around your organization or building, to dangerous streets that may not have a traffic light, or dark alleys or abandoned buildings that youth go through on a regular basis. So these are the 7 areas that we would have those multiple focus groups use as a stimulus for generating risks. And again, our goal here is to try to come up with as close to all of the risks that exist in the environment at that moment in time as possible. In the second step, we try to get broader input within the organization. So we may ask that not only the work group that helped generate the brainstorm list, but also other staff, other volunteers, other board members give us some input. We've used a simple survey where down the left-hand side you see the risks that may have been identified, and we asked staff and volunteers to answer 2 questions about each of these concerns. How often does it happen? And how concerned are you about it? You'll notice a little further down there's also blanks, and probably the most important part about this step is picking up missed risks that maybe the work group and the parent and the youth group didn't pick up on. So this is our way of making sure that we've gotten all the input possible from organizational staff, and we've hopefully come up with as many risks as possible to address. In the third step, we focus on coming up with a solution for each one of the identified risks. And it's important that these be realistic solutions that may go without saying, but there are times where I've heard solutions bantered about that aren't economically feasible. We do give priority to prevention strategies, and when we can't do prevention strategies, we use risk reduction strategies, and I'll tell you more about that on the next slide. Of course, we're also interested in what are the real costs of these strategies to make sure that the solutions are practical. I mentioned that we give preference to prevention strategies. The advantage of that is when we've prevented something, it's not there anymore, so it's no longer a risk. So for example, if we have problems with your organization with multiple entrances, a somewhat simple fix may be locking all doors, but the door that comes past the front desk. We've prevented people from coming in those other entrances. There may be some instances where we can't prevent things. For example, if your organization offers evening basketball where we invite parents and community members, you could prevent that by locking them out, but that's inconsistent with your mission. Instead, we look for a way to reduce the risk associated with that type of behavior. And what we might do is we might check everyone in, take their information, put a name tag on them so staff can identify who's been checked in and who hasn't, and that would be a risk reduction strategy. In the fourth step, we take the risks and the solutions that have been generated, and we work to prioritize them. And the prioritization process is really based on what are the costs that are involved, what are the resource demands of different solutions, and how concerned are we about particular risks. In a very simple way, we ask our organization to take the list of risk-solution pairs and sort them into 2 piles, the easier to solve pile, and then also the more challenging pile, and then within each of those lists to prioritize. So for example, an easier to solve type of issue may be that example I gave about locking the doors. More challenging might be the example about nighttime basketball. In the fifth step, which is really the last active step in the process, we focus on developing implementation plans and taking action. What we found is that all organizational personnel are multitaskers, but they have their limits, and that dealing with 5 issues at a time, 5 risks at a time is a good number. So we ask them at any given time to try to work through their list of risks and solutions 5 at a time, with 3 of those being from the easier pile, 2 from the more challenging pile. Each time one of those risks is solved, they elevate the next one onto what they're currently working on. So if it was an easier problem that was solved, then they take the next highest concern off the easy list. For each of these 5 areas, we ask folks to come up with a detailed implementation plan to guide their work, and to also consider what policies need to be adjusted as a result of the implementation of this strategy. So here on your screen is an example of an implementation plan. If you look across the top, the first column identifies the risk that you're dealing with. The second column identifies either the prevention or risk reduction solution you're going to employ. The third are the steps to accomplish this solution. The fourth column is who's responsible for implementing each of the steps and who's supervising. The fifth column are what costs are associated with each of the steps, and is there a funding source if there is a cost. Next column is what's the due date, and the final column focuses on issues around if you implement this, do you also need to change something in your policy manual to be consistent. So the example here, the risk is a large number of unknown adults in the building when there's sports going on outside. These might be folks who want to use the telephone or the bathrooms. And the prevention strategy that we're going to use is we're going to restrict the building bathrooms and phones to youth only, no adults during those times where there's outside sports that attract parents and community members. The steps to accomplish this are first to create the policy with input from youth, parents, board members, and staff, to send out a memo to organization families about the policy change, distribute flyers about the change in the policy at the next sports sign-up and events, to post the sign about the policy change before it starts, train staff about how to politely but effectively and firmly implement the policy, post the signs right before you start the policy, and then lock the doors. As you can see to the right, it says who's responsible for each of those steps and who's supervising. The next column to the right identifies costs and sources of funding, what the due dates are, and it also suggests that we'll need to change our organizational manual to make this part of a larger policy and allow the organization to implement this. So these take about 10 minutes for staff to come up with. So for the 5 that they're working with, less than an hour to actually pull them together. The last step in the process is making a commitment to reassess and repeat this process maybe 6 months or a year's time. The importance of this is organizations are amazingly dynamic types of settings. So programs change, staff change, youth change, and it's important to pick up on those. The second reason to do this is it's a check on the solutions we've put in place. If a risk comes up again, it's feedback that the solution we put in place may not be as effective as we thought, and we need to rethink it. So that's the 6-step process. Let me just take a few minutes and talk about our 3-year project with Boys and Girls Clubs of America to examine the effectiveness of this approach. So this has been a wonderful collaboration, and you'll notice some of the contact folks from Boys and Girls Clubs of America. It's been funded over the past 3 years by a Vision of Hope grant that I received from the Pennsylvania Coalition Against Rape. The goals of this project were first to develop a sustainable self-assessment process based on the Situational Prevention Approach, or SPA, to address risks for the 4,000 plus Boys and Girls Clubs that exist. Once we identified this, the second goal was to examine the effectiveness of this approach. In year 1, what we did was I worked with 7 different clubs in 3 different cities, Pittsburgh, Philadelphia, and Portland. And we worked through the 6 steps and received feedback from them. And what that resulted in was a implementation manual, a self-assessment implementation manual that was intended and designed to hand over to a particular organization or club for them to do this process on their own. In years 2 and 3, what we focused on is looking at the effectiveness. So we've worked with 16 clubs across 4 states, Indiana, Florida, New Jersey, and Oregon. And in each state, there are 4 clubs. 2 of the clubs start out doing the situational prevention approach. 2 serve as waiting list controls, and we compare the effectiveness. And then in the 3rd year, which is this year, we're looking at the clubs that were doing the waiting list and how they did with a situational prevention approach. Very quickly, in terms of findings, many of these clubs, I don't know how much you know about Boys and Girls Club, but they specifically place themselves in the most impoverished and challenging parts of town. Despite these challenges and heavy demands, all of the clubs reported high satisfaction. On a 4-point scale, the overall satisfaction of rating each of the 6 steps for all participants was between satisfied and very satisfied, which was a 3.2. Most importantly, the clubs that participated in the approach identified 7 to 10 times more risks than the control clubs. For each of those risks, they were able to identify a solution, and over a 3-month period of time, say approximately 70% of those solutions were implemented. And we'll have the final information for the 3rd year by summer, and we'll know how the whole thing turned out. In terms of next steps, as I mentioned, we'll be completing this project with Boys and Girls Club, but we're interested in looking how SPA works with other types of organizations. I've had a chance to use it with child or children's hospitals, and now I'm using it with a child and adult hospital system. It's being used in 1,200 churches across Thailand, and we'll be collecting some information about the effectiveness there. And we're interested in looking at how it performs with other youth-serving organizations. As I mentioned, we'll be completing the Boys and Girls Club project this summer, and we'll have some information out about the findings, but the first year of findings are extremely promising. Finally, what I want to mention is that in the last month, I submitted a grant to the Centers for Disease Control, and it's a larger version of the study that we did with Boys and Girls Club. This larger study, if it gets funded, would include Boys and Girls Club, Big Brothers and Big Sisters of America, U.S. Olympic Committee, and the more than 44 million youth that participate in sports, and also participants in community colleges. So we also want to look at how it does in enhancing safety with adults. The significance of this, if we're able to do it, if we're funded to do it, it would reach more than 50 million children and adults as participants of these organizations. So let me wrap up by saying that I'm more than happy to answer questions. Feel free to email me. If you're interested in using the situational prevention approach, I'd ask you to get in touch with me so I can get you some updated materials, and also so that we can keep you on a list so that we update information as it becomes available. So here's some contact information for me, and that should be available in your handout as well. Again, I'd encourage you to take a look at purchasing the book that was part of the stimulus for doing this. I will tell you that all the proceeds go to ATS's Prevention Committee. And let me stop there and leave some time for questions.
Great, thank you, Greg. Keith, that was wonderful. Thank you so much. And although I've heard you speak before, I just have to say that around this topic, I just have to say that each time another piece of this is added, and I'm really just so excited about just being able to hear this and hear what you've been doing. So thank you. And I wanted to let people know that absolutely contact Keith if you have interest in learning more about the situational prevention approach and his model. Also, if you have questions, please type them in. I know I've already gotten a couple questions, but if you have any questions today for Keith, if you type them in, I'll try to get to as many of them as possible. So Keith, and also just as a reminder that that on the bottom of the screen here is the discount for the Prevention Sourcebook, which we're selling here at NERI, which also has a great summary of Keith's work. And Keith, you remember to put your webcam on, so nice to see you. So maybe just to begin with, just how, I think one of the questions about me, I know personally from working with a lot of youth-serving organizations, this can get a little overwhelming. So maybe if you can describe a little, how long, the question was, how long does this take? And what do you say to an organization where it says, I know my staff, we run a tight ship, you have a lot of volunteers, I'm really not concerned that it happens here. So if you can maybe answer both of those questions.
Sure, that sounds fine. And if I forget the second piece, please prompt me. In terms of the time it takes, actually, the time is varied that the Boys and Girls Clubs have used to finish the approach because they fit it in between other things. It looks like it takes on average, about 9 hours total. Most of that are the meetings to do the brainstorm and the meetings to come up with the solutions. And there's a piece of this that actually took a big chunk of time, and that was the survey in the second step. And we've actually just revised that so that we're cutting out the survey and we're going to be using more of a checklist type of approach for that step for broader staff to take a look at the risks that have been identified and come up with solutions. We expect that that should knock at least 2 or 3 hours off the total time involved.
Great. When Patrick Lemon, who's a good friend of ours, suggested we may want to describe who ATSA is in the Prevention Committee, since not everybody on the call may know that.
Sure. And actually, can you prompt me with the second part of the first question first?
Oh, sure. I think the listeners, I was going to get back to it since, but the second part, which was actually another, we've gotten now a couple times here, which is how do you deal with the resistance that some organizations may have when they feel actually safe enough already?
Well,
and
sure.
From both Lydia Diaz and a few other folks.
Sure, I think that's a great question. Let me start with kind of the broadest response, which is that actually at a couple different talks have actually been stopped by insurers for major organizations who have talked about how encouraging they find the approach because it's very broad-based. So I would start in responding to people by saying that it's not about how good your staff is. It's about trying to find an additional edge. Interestingly enough, if you remember the finding from the data I presented just a couple minutes ago with the Boys and Girls Club, that the clubs that were using the approach found 7 to 10 times more risks in their environment. And that's not because the clubs who are doing business as usual weren't looking, because that's part of what they do on a daily basis. So what I would say in answer to that is that in terms of creating the safest possible environment, we always need to look for new strategies. We need to look for new ways to identify things that we may miss, and we need to look at ways to organize our approach. For example, situational prevention is more of an organizational shell. It works very well with those content-based prevention strategies that are out there, but it helps us have a systematic, organized way of looking at the risks in our environment, stopping for a few moments or a few hours, making that a priority. So, the resistance, I think, is something we can get past because it's not about, is the danger have to do with our staff? It has to do with the more positive side of how do we look for new strategies to make the settings even safer, and how do we also keep in mind those issues about, things like insurance. Most of the organizations I've talked to, one of the largest bills that they have on an annual basis is their insurance. And there's good reason for that because things happen in environments. The more we can be ahead of the curve, the more we can identify risks and address them, the safer we can make it for the kids, and the more cost effective we can make it, the more money there is for an organization to put into programming rather than worrying about lawyers and media and media consultants and increasing insurance rates.
Great, thank you. Do you want to just take a quick minute to explain ATSA?
Sure. ATSA is the Association for the Treatment of Sexual Abusers. It's, to my knowledge, largest international organization of professionals who work with and do research on effective treatment and management of offenders as well as prevention. And the Prevention Committee has been probably around for about 10 years. So the proceeds from this book all go directly to ATSA to help support the work of the Prevention Committee.
Great. And just like you got a shout out from Jose from the Boys and Girls Club of Central Florida that said he wanted to comment that the discussion we've had with the staff and volunteers has been great. It was great to see the perspectives on everyone's end, which actually leads, what I love is great into the next question by Jenny Coleman, which is basically who's invited to the brainstorming meetings and what roles do they play in the YSOs? And I think the other question that came up a little bit earlier was also like, do you involve youth? This was, and do you communicate with youth through this process as well? This was by Myra Altanow. So. Right. So I think that those all seem to fold together. So I'm throwing them all at you at once, if that's okay.
Sure. And again, help me if I miss pieces of it. I want to make sure I'm responsive. But the front end of this process is really what drives things. So the more effective we can be in doing a really good job brainstorming risks in any type of youth-serving environment, the better the results will be on the other end. So as I mentioned earlier, with Boys and Girls Club, we've tended to use a combined work group that's made up of volunteers, of staff, of board members, sometimes even key stakeholders in the community. But we do always make sure that we include parents in the process as a separate group of folks who give us input about what risks they see, and then also older teens. I should say we tried in the development process to use younger children, but we spent more time chasing them around and trying to keep them on task than we were actually able to get input. But I will say that the idea about multiple input, it's not set in stone that you have to use those three groups. I mean, clearly we would always use the organizational group, but you might want to bring in community members. You may want to bring in the whole board to provide input. But we've found that with parents and youth that they've consistently come up with risks that staff and the staff work group hasn't identified. So it's been very validating to use them.
Great. Yeah, and I know Nan Stein has actually done, I don't know if you're familiar with her work around where she's done some mapping, where she gives them a map of like the school to younger kids and gives them crayons and lets them, color in the red zones or the green zones for them. And was wondering just, anyway, if you have any thoughts about that, but I think that may be one way of involving some younger kids as well.
I think that's great. I think that part of what ends up happening, though, is we try to find some balance and try to help the organization find a balance between efficiency and effectiveness. And, with the younger kids, for example, and even with the teenagers, one of the questions that we have in the manual to ask them is, if you were going to hide from staff, where would you hide in the building? So that's not quite coloring, but that was one of the most productive questions that we used with both the younger and the older teens. So I think it would be great if you can be more inclusive, and there's definitely no rule against being more inclusive with this process. What I described, I would think of as the minimum of what you'd want for input to get a good outcome. I also think it's important to get enough parents and enough youth, because otherwise you're going to miss a really wonderful opportunity to get some different perspectives. Oh, I should mention, pizza is important. The most critical thing we found for both getting parents to come in, believe it or not, and also to keep youth attending to things is ordering a favorite local pizza.
Right. Sometimes those are the tips that actually make the most of difference in trying to work with an organization.
It seems kind of silly, but it does.
Yeah. So Laurie Seaman asked that a lot of what you're talking about seems mostly like a risk reduction approach to how they incorporate, and was wondering maybe how you incorporate primary prevention, as defined as preventing the idea of committing assault from entering the minds of someone who might be at risk to perpetrate sexual abuse. This means that may be true, particularly if you're talking about youth to youth. And I was wondering if you had any thoughts about that.
Sure. Well, we've had a lot of conversations about how you define this approach. So, for example, if you were doing it with the whole population of Boys and Girls Clubs, does that make it primary prevention? I didn't talk as much about it, but part of the process in doing this is actually also identifying strengths and protective factors. Your strengths and your protective factors actually become many of your solutions. And there are times where you're actually identifying some of the protective factors that exist in the environment that keep a risk factor from turning into an incident. So, first off, at that level, I think it's important to consider the fact that while I didn't attend to it a lot in this talk because my time was brief, that there is that attention to developing risk factors and identifying risks as part of the process. In terms of more attention to specific development of healthy sexuality or positive strengths in the youth, that's kind of beyond the scope of this approach. One would hope that those are the kinds of things that any of those youth-serving organizations that I mentioned have incorporated as more of a content-based type of focus. But again, the situational prevention approach is really intended to complement other existing approaches. It's intended to help organize a very systematic response, and it's intended to try to help people think more broadly about the kinds of things that exist in the environment, both positive and negative, that can be brought to bear to create an even safer environment.
Great. We also got a question that, of the sort of 7 areas of assessment, are there any that tend to be sort of either under-assessed, ignored, or that organizations sort of tend to maybe not be quite as aware of? And that came from Heather Galvin.
Sure. Well, I think that there's a couple things. Those 7 are ones that we've found to be pretty useful across some different types of organizations, especially they were an especially good fit for Boys and Girls Clubs. I think that there's the potential for tailoring them. So, for example, I mentioned that I've done work with a few children's hospitals. With children's hospitals, we tend to move some of those risk areas in and out. In terms of are they under-recognized, I think a lot of that has to do with particular type of sites. So, for example, I'll stick with Boys and Girls Clubs because that's what we've been spending the most time with. First off, you're talking about shout-outs. Incredibly fantastic organization that does an incredible amount with a large number of youth. I think 4+ million youth with very little resources and in some of the most challenging parts of town. The other reason for mentioning that is you can have facilities that are mere blocks away, and the kinds of concerns that they need to address can be very different. That could have to do with the age of the building. It could have to do with the kind of programming that they're focused on. It could have to do with whether they have more of a focus on young kids or older children or teens. So I wouldn't say that there's been anything that's consistent. I would say that a lot of the feedback we've gotten has been very validating because when we look at, a group of different organizations within, let's say, a 10-mile radius, we get very different feedback about some of the risks. And for me, that's important because that's feedback that the process helps individuals tailor the identification of risks to what they're really experiencing locally, and a lot more investment in dealing with risks that are theirs and specific to them, as opposed to having to deal with a list of risks where some of them, may work for somebody who's 4 blocks away or a quarter mile away, but really isn't as germane. So that's part of where the efficiency comes in, some of the self-tailoring.
Great. So, Amy Turner asked if you could maybe just talk a little bit more about your prevention section, the source book, the Preventing Sexual Violence, a Practitioner source book. If you could tell people a little bit more about that, that'd be great.
Sure. And actually, it's kind of tacky, but I'm going to grab it off the shelf so I can look at the table of contents. Always have one close by.
That's great. That's the best promotion I've seen.
Sure. Well, I think that it's been a great partnership with NERI. So even though I'm not getting the profits, they go good places in supporting NERI and also supporting the Prevention Committee of ATSA. I'm not sure specifically what she's looking for in the way of details. I would encourage you to go look at the website. Joan, if I'm correct, I think she can access the table of contents.
That's right. The table of contents on the website.
Part of what the book actually grew out of is I was actually president of ATSA, and we had developed a prevention committee, and we decided that the world had more than enough white papers. And so I got the idea. I looked around for a broad scope prevention book, and I really couldn't find one. So that was some of the motivation. I would say to you that the people who are authors on this are kind of a who's who of people involved in preventing sexual violence. Everything from people who have been part of the movement real early on, like Carol Plummer, to people like Ernie Allen, who for years was the head of the National Center for Missing and Exploited Children, to folks from CDC, We also have a lot of organizations represented, including Stop It Now, Darkness to Light, Men Can Stop Rape. So we have a highlight of some very effective types of programs. And then there's a lot that's specific to if you're interested in enhancing prevention or doing program evaluation with prevention programs or incorporating theory to make a strong case for the fact that your own program is evidence-based. There are some chapters in here that talk about linking to theories, that also talk about importing and documenting existing programs. And then there's some great international stuff, a woman named Celia Breckenridge, who's kind of a legend in looking at preventing sexual violence in elite and Olympic athletes, did a chapter for us. And Lisa Aronson-Fontes did a great piece on cultural issues. So I hope that gives you a little bit more about the richness. There's 30 different chapters, and again, just a whole host of people from around the country and around the world who participated.
Yeah, no, I think that's great. And I think the fact that you said that there really isn't any other book that we know of that actually has that kind of collaborative approach towards really doing a comprehensive overview of prevention and what's out there today and to mention just one more time that we do have a discount. So we just call the toll-free number there. And if you want to go on the website, just to say that you have to, there's only room for Kaufman, not Kaufman. So just don't be nervous that it will work as Kaufman. I just want to take a moment to also just do a little bit of ending piece here and to just remind people that Neary Press, we have actually our new catalog out. And if you would like a hard copy of that, just send us a quick email and we'll be happy to put one in the mail to you. It has this book as well as lots of other really sort of cutting edge research that maybe I think and practitioners' information that'd be really helpful to anyone who is interested in this work. Also, that to say, when you've been on this webinar, we've automatically signed you up for our free e-newsletter, which we take a article each month and then put it into an easy-to-read newsletter that we'd say is short enough to read while you're drinking a cup of coffee. Just housekeeping reminders that we did post the correct PowerPoint, and also recording of this webinar will be on by next week, and we'll also send you a notice with your certificate of completion for attending. And if you like this webinar, you can see previous webinars on our website as well as www.nearypress.org. These are the list of the previous ones from this particular series, the 2013-14 series. And we have one more coming up on June 10th around juvenile registration notification with Elizabeth Letourneau and Andrew Harris. That should be very, I think, really interesting to see what's known about registration notification as it's applied to adolescents. And we want to give a big thank you to our sponsors from this year. We could not have done this without you, so thank you so much. And again, please think about, consider becoming a sponsor for 2014-15, and we will list you here as well if you're an organization. Our sponsors included the United Methodist Family Services, St. Joseph Orphanage, James Reynolds, the Central New York Psychiatric Center, the Durham Family Court Clinic, the Center for Clinical and Forensic Services, the ITM Group, and Ranch Erlo Society. Thank you all for your support. And I want to just give one last thank you, a huge thank you to you, Keith, for doing this. I know that your schedule is incredibly busy. You've been doing this all over the world, all over the country, and Thailand too now coming up. So really thank you so much for doing such a great webinar. And thank you for everybody who attended the web conference. We truly welcome your feedback, so please be sure to sign out when you're done and complete the evaluation form. And for those questions that we did not get to, please feel free. We'll be sending this over to Keith, and feel free to email Keith directly. His email address will be in the presentation slides that are on the website. So definitely contact him, and hopefully with CDC funding, he'll be reaching out to you too someday. Again, Keith, thank you so much for doing this. Yes?
Joan, can I just say thank you to you? And also, if anyone's interested, I am using the book to teach 2 different university courses. So if you're interested in that, please email me.
That's great. Yes, please. Any university professors would give discounts as well to the university. So thank you, Keith, for reminding us of that. All right. Have a great day, everyone. And please go out and talk to your favorite youth serving organization now that you know this information. Take care. Bye-bye.